There are more than 350,000 reported cardiac arrest cases per year in the United States, and only 10% of those victims survive. However, in instances where a victim is immediately administered CPR and defibrillation, their chances of survival double. Today, thanks to our friends at St. Francis Hospital and Mercy Medical Center, I am proud to announce that the town of Hempstead is receiving 50 defibrillators free of charge to be placed in town parks, pools, senior centers, and other installations throughout America's largest township. You might wonder why we are at a Little League field to announce the town's receiving 50 defibrillators. After all, young kids should be at the peak of health. While that is true, young athletes can be susceptible to blunt force chest injuries that can lead to cardiac arrest. Indeed, a Little Leaguer in Merrick went into cardiac arrest in September of 2009. While a defibrillator may not have helped in that instance, the baseball players' parents have become advocates for placing defibrillators at youth athletic fields. In short, all of the places where we are putting defibrillators are locations where a life could be saved in the event of cardiac arrest. You don't need any special training. Instructions are simple to follow in an emergency situation.
Follow these instructions.
I've absolutely witnessed people that have gone into cardiac arrest that are saved by defibrillator units like these cardiac science units. Defibrillators are a key tool in dealing with cardiac emergencies, and the faster the access and the more units, which is what St. Francis and Mercy Medical Center has provided for us, the better the chance that these units will be in the right place at the right time and will save a life. So.
Typically people get frantic and they don't know what to do, but here's a device that's immediately available that can be used by anyone, and it's life-saving care.
So we looked at it as a perfect opportunity to partner with the town of Hempstead, and understanding that Mercy Medical Center is part of Catholic Health Services, felt the opportunity there to work with St. Francis Hospital, did the Heart Center, to partner with them to do this initiative.
Do not touch the patient.
Okay, everyone stands clear. Supervisor.
The quicker you get treatment rendered, the better your chances are of recovery and, of course, survival. You know, oftentimes, especially in a ball field, you have not only the children, who obviously it's of critical importance because of the whole issue with impact injuries, but the parents. You know, how many 40, 50-year-old patients will have their first heart attack at that age, and in a setting where it might be hot, or they're excited, or there may be a lot going on, that's a perfect venue that might happen. And of course, our grandparents. We all want our grandparents visiting and watching our children be at these events, and they're probably the highest risk.
We're here several times a week between Little League practice and just playing at the park, so something like this is just an added sense of security.
You have to use the defibrillator to get their heart rate and their pulse rate, and basically it tells you step-by-step instructions what to do if you don't know what to do. This device could save somebody's life.
Yeah.